All this is Dr. Mubeen Syed from drbean.com. Welcome to one more show. So, this is our exceptional show in the morning with an exceptional guest that you have met once before as well. We have Professor Dr. Terrence Kommal once again with us. We're going to talk about two important topics today. And one of these is this study that I touched on yesterday a little bit. So, Professor Kommal is going to look at that a little more in detail. And we would discuss if the immune escape has occurred or is about to occur, or vaccines have failed with Omicron. And the second part is that latest status on the ground in South Africa. What is the situation in the hospitals, ICUs? What are the latest uh, cases and deaths? So, whatever data we can glean from Kamal on that as well. So, Terence, thank you very much for joining us once more. Welcome. Tell us once again for the new viewers a little bit about yourself, and then we'll start the talk.
Awesome. Thank you so much, Mubeen, for having me. And very good morning, good afternoon, and good day to everyone streaming in. I'm Dr. Terrence Kommal. I'm a medical doctor in South Africa. I've trained in health policy, statistics, science, but primarily a clinician. I'm involved in a range of healthcare businesses, but do a lot of work in supporting government to make sure that there's equitable and justified services provided. So, simply put, I'm a servant leader with a strong passion for healthcare and service to humanity.
Thank you very much. So let's get right into this. The study that we're talking about. First of all, tell me, is this a published study? Is this a preprint? What is the status of the study? And I'm going to put that up on the screen as well.
Sure. Essentially, my understanding is this is not a preprint or a peer-reviewed study or from any journal. Given the way it looks, and from what I understand, it was put out closer, and this is what I was told by media colleagues who alerted me to it. It was put out about 11 p.m. South African time 2 days ago. So we're looking at under 48 hours ago. It was put out, but it was very interestingly accompanied with a strong press release to the media of the narrative that's being interpreted from a very complicated paper, as you can see, with tens of researchers involved. Although originally from different places around the world, it looks like at this stage, all of these researchers, irrelevant for where they're originally from, are currently based in South Africa.
Got it. When I heard about the study, so I have not thoroughly looked at it. I was actually hoping that we both will do that together. So here we are. But when I heard about the study from the media and people started sending me tweets and they started sending me private messages that, hey, the immune escape has occurred and the virus has actually gone out of our control. Um, Again, for the cool beans over here, please make sure that the clinical side is an important outcome as well. So if we say the immune escape has occurred, what is happening to people? We do not have a SARS-CoV-3 yet. That is my understanding. We'll see with more data. So the question to Terence, uh, this became a panic. What is the situation? How can we look at this study and make sense of it?
Sure. Thanks, Mubeen. What I understood, and this was information shared to me by my colleagues in the media, because I had expressed some concerns, as I did in the previous conversations that we had, on where the narrative is going and what may be the reasons behind it. I don't have reasons, but I am having more questions than answers at this point, purely based on the data that's being put out. And the first thing that was alerted to me by the journalist of a significant media publication was, but Terence, this is not a South African. It's a German scientist. He made this finding. And I said, awesome, send me the paper, which he did. And that's when I realized my colleague, who's a well-celebrated scientist internationally, Dr. Professor Alex Siegel, is originally German descent, but actually lives in South Africa for more than a decade. He also works in a lab in a facility in the University of KwaZulu-Natal, originally called KRIT, now AHRI, which is in the same region associated with Caprisa, CRISP, and all the others. So it looks like, and given the authorship of the paper, there's a close association between our learned colleague, Professor Alex Siegel, and Professor Slim Karim, Tulio de Oliveira, and others. If you look at we slide up slightly into the credits of the authors involved, it seems to be everybody else who's been involved in South Africa on all of the previous data being put out in the various waves are also intimately at least credited for participating in this study in some form or the other.
Interesting, very interesting. So again, this created panic. So tell me this: You went through the study. How much panic should we have, and how should we look at the study? Can you help us walk through this?
Sure. If I
And
may,
would
Mubin,
you,
and if we slide a
sorry,
little bit down to the last paragraph of this of the same page, what concerned me is the narrative being put out is correct, but with a caveat. It's incomplete based on their own findings of the study. So if we look at the first highlighted line at the bottom of that paragraph, it says, however, the escape was incomplete, which in this context means the immune escape of Omicron, with 5 of the participants all previously infected, showing relatively high neutralization titers with Omicron. That's a mouthful. Simply put, it says 5 of this very small sample, 12 people's samples, not patients, blood samples that were used from patients previously taken actually for another study. These blood samples were then used, and we're saying participants, it's actually not participants, but the samples that were used in this lab study, 5 of them actually had a great outcome in defending, or to a large extent, against an Omicron infection. These 5 are 5 of the 6 that were previously infected with what looks like the original variant. But when one looks at the data table, which we will get to later, one of them actually was pre-exposed to Delta. My understanding of this, if we actually even look sort of halfway down in the second paragraph, it says the results we present here with Omicron shows much more extensive escape, which is not in dispute. I agree with that finding based on what they say in their study. However, they say the escape was incomplete in participants with a higher FRNT 50 due to previous infection. Their last finding is critical. Previous infection followed by vaccine or booster is likely to increase the neutralization level and likely confer protection from severe disease in Omicron infection. Now, the first question I would have is based on blood samples used in a lab in a petri dish, if I could put it loosely, kind of sampling study. I don't know how you can differentiate the severity and how much protection you have, whether they're serious or not, because I don't think you can speculate that with conviction as a scientist being done in a lab where you're simulating environments. Then the
this is
cell study that.
actually, my apologies for the interruption. This is actually what made me wonder yesterday as well, that how did they know that somehow the severity will not occur, but remaining, this is happening inside a lab. So you are hitting it right on the head. And I saw WHO yesterday. Sorry, I want to insert the second comment as well. I think they were referring to this study as well.
Yes.
So
I think the
sorry, back to
challenge
you.
I have with this, Mubin, and you're 100% right. So please chip in. You're more of the expert in this space, I assure you, from an immune perspective. But when the world is being told, and they're not being told the size of the study, these are 6 + 6 blood samples. So maybe I think before we go into the rest of it, if we could slip down quickly to the data sheet or the graph on the last page. Now, these are important sets of data for me because this is actually the raw findings of what they had. Is one is the advanced age or the average advanced age of these patients. You and I would agree, Mubin, patients at advanced age, as you've rightly said in your previous presentations, have a far higher likelihood of chronic disease, immune conditions, and a combination of immune issues completely independent of Omicron or COVID at any stage. So these patients are vulnerable patients. What we're also not told is what is their HIV status, with South Africa's statistics of at least 20% or 1 in 5 being potentially positive. That's important. Has the patient has TB or any other chronic diseases that impact the immune system? We don't know that either. The comment in the last line is something we need to reflect on. Evidence of reinfection in one participant, June 2021, which I don't dispute that the patient actually had a reinfection with Delta, which actually means there was reinfection risk with Delta, not only with Omicron. But nobody's made a song and dance about that in the past, have they? Or not that I'm aware of in terms of any research papers. But if we look at this in isolation, when they say 5 of the participants did better, this is not 5 of the 12 sample. This is 5 of 6 who were previously infected. According to
So
me,
so let
making an
me,
inference on the data, yes, maybe.
yeah, please Complete your
No, no,
thought.
I agree with you. And this is where we chuckled about it. Is the first impression I had when I converted the data is I said 40% of the people, i.e., 5 of the 12, have a good protection if they had a previous infection and have vaccinations or boosters, which is good for us to hear, but nobody's giving you that finding on the study. But it's actually
Hmm.
different. 5 of the 6, because only 6 were infected, which means if I can infer 85% of people who were previously infected and are now vaccinated will be adequately or at least largely defending against Omicron. Now, this doesn't talk to a reinfection risk. This actually says the opposite because this is the first formal trial where Omicron's exposed to blood samples of people who've been previously infected.
This is such a beautiful insight. Uh, Again, I did not go a lot in detail. We touched on it yesterday in a talk. So, what really they did was, number one, the sample is really tiny, 12 people's samples. Studies in vitro. In vitro is
Yes.
fine. There are many other in vitro studies too. But then 12 people's sample is actually divided into two that they've done here as well, vaccinated only and infected and vaccinated. However, when they are inferring the results, they're dividing by 12 instead of saying infected and vaccinated six, and out of those six, five were protected. That's a very good number. And
Yes.
similarly, other six separately handled. Instead of that, they're just using 12 as a denominator for every data point and making those data points look bad. I am not happy with what happened here. Okay, so please continue to walk us through this.
Sure. Moving the other finding, but I'm sure you'd be able to share a lot more expertise into this, is on the Vero cells. When they spoke of they wanted to know about Omicron being able to replicate and transmit within the body and what it does and how it replicates, the impression created on some of the data being shared with the media, well, that's my understanding at least. I may be wrong, but that's my understanding of what impressions being created is yes, Omicron will replicate. The perspective is when they said participants, that somehow these people were exposed to Omicron and they studied this. But you being the domain expert on this more than me, I had to actually Google this. Vero E6 cells are monkery derived cells, and these are lab generated, created cells. These are simulated cells, but they say it's lung tissue. It's not actually lung tissue. These are
Right.
lab grown cells, right?
Yeah, these are transfected cells. These are prepared cells. This is a similar thing that we had a study from Sweden as well, where they had cells that were specially prepared. Normally, it is okay to do that for testing and a directional purpose to say this is the direction to go, and then they do more studies. What I am surprised about is, as now you are walking us through this, 12 people sample. The samples have two basic categories on it. Sample is coming from folks who are in advanced age as well, so they would generally not respond very well. And then uh, incorrectly, even using that tiny sample incorrectly to create a buzz, and there is a buzz worldwide. I was watching WHO's 1 hour talk yesterday in which they also alluded to this study as well. So I don't know when. So thank you very much for having us walk through this and become thinkers about this one by pointing out some of the things, because I don't see anybody else thinking about it. And I can
I
tell
think
you one
that's
more
important.
thing. So
Uh,
this is my little lament here, that we will be sitting here and actually providing clarity that this actually is not the data to be worried about. But you would see that those who are saying this is to be worried about and we are done and this is all messed up, they will be much more viewed, and they would be much more remarked about, which is the sad part. Anyways, back to you.
Sure. Babin, as me following a lot of your presentations and data and a lot of the amazing work you do, it stimulated me to look at this again. And I think that's been an important factor is I'm not making my own inferences. At least I'm interpreting it, and these are my views. If I'm wrong, please. If any of you, the cool beans, have a different view, please kindly share that with us. But given the fact that when we're looking at their own data and their own conclusions on page one of their findings, I'm disturbed that only one line of the entire outcome of the study was put out there, and that is concerning, uh, because if you have multiple findings and you say 6 of the 6 means there is a potential risk of immune escape, but 5 of the 6 of previously infected and vaccinated are fine. Your data's almost correlating. You're one patient off, or sorry, one blood sample off in an in vitro study. That to me doesn't create a statistical difference between the two. If you had 1 in 6, I'd understand. Yeah, you got
Hmm.
5 and 6. It's a bit too close to call, right?
Got it. And I'm gonna very quickly uh, put some comments up as well, just to bring in the cool beans. So Sergio says this is not the only neutralization study. Other labs showing similar results. And I want to add this as well, that imagine if this all was actually true as well. It's still the media buzz and scaring and making people afraid is still not justified, because at the same time of these studies, there is a clinical stream of data, the data from the clinical side coming in as well, that is showing, hey, this is not that worst of a situation, it is a mild situation. So we should consider that in this as well. This is, again, it is like having a sleeping person wake up and say you should take your sleeping medicine. Clinically, if people are looking fine, then what does it matter how this is happening, unless we say that there is going to be another variant. We'll talk about that later on. So this was a good comment, Sergio, thank you very much. Back to you, Terence.
Sure, Mubin, I'm in your hands. I think at this point, what we need is even, and let's not say we, let me speak for myself. For me to have more comfort in the outcomes of these studies, I think there needs to be a slightly more independent team that's completely disjointed from the team that made the original Omicron finding, that's related to the same studies and research. Because something, and if we maybe look, if you have a moment to skim at the funding of the trial on those slides, the funding of this trial, if we, I think it's probably 2 slides down, maybe at the bottom. Yeah, if we just slide down a little bit, I think it's yep, we're coming up here. Acknowledgement there, right there. This study was funded by the Bill and Melinda Gates Foundation, the NIH, the Medical Research Council, the NRF, and a whole range of other grants. I actually took the time to go and look what this grant was for. The grant from the Bill and Melinda Gates Foundation was actually funding to study the impact of COVID infections in patients with HIV and TB in South Africa. So I'm not sure how one is extrapolating this funding for this kind of study topically now, and I don't think there's an issue with that. But the original intent and approval was for something completely different. How we can
Interesting.
extrapolate and link this to the current findings, I don't know. But again, the study's been done. On
Hmm.
what I said on the same of the sequencing concerns, the sample is just too small. We're not being told these are not live patients. When we make comments of participants, the presumption is you have participants. These are blood samples that were extracted between July and September 2020. That was more than 12 months ago. We had a
Hmm.
very, very different perspective of
Is this
what
true?
the picture looked like.
We tested 14 plasma samples. Okay, so what they did was they took the plasma samples and hoping to have the antibodies in them, and then they
Yes,
used those antibodies against Omicron of today and tried to see how the response is. Very
yes,
interesting. So thank you very much for this walkthrough. I'm going to look
sure.
at the talk. The what is this, the comments, just to make sure if there are any comments related to the study we can answer them, then we switch to the stats if you're comfortable.
Absolutely.
So there is a question here. Winston says we need to know two things. One, does Omicron provide resistance to other strains? Two, does Omicron case cause a clotting and other high risk complications? This may be a good segue to move to the stats as well. So I'm going to hold on to this one for a second. James says, yes, I always start with the funding before reading a study. Conflict of interest possible? Maybe yes, maybe no. Has good videos and vitamins. Um, this is interested. So people are, this is the thing. Sometimes folks are scared. So, all right, it seems like we may not have a question here about this study. Now let's switch to your second part of the discussion. How are things in South Africa? What is the latest there?
Sure. I think, Mubeen, there has been a massive growth in numbers. When I say massive, it's significant, but I'll draw some correlations. I didn't take today's data because by the time we prepared for this, I have at least yesterday's data on the number of positive findings. But what I did find importantly is the latest statistic on the sequencing and the numbers of admissions and hospital admissions, which I think is very important right now.
Excellent. So, at least from the Our World in Data's point of view, December 8th, 13,493 new cases. And if we look at the death rate, which I am pleasantly surprised, I wish that even these deaths are not occurring, but deaths are actually keeping at the similar levels as before. So, that's very
Absolutely.
interesting. Okay, so should I bring up your slide deck?
Yes, please.
Okay,
Oh,
here
there
we
we go.
are.
Thank you for that, Mubeen. If I may go through this, this is the data that I've got from the NICD. This was reported yesterday. So there's a slight mismatch on what you have from our world in data to this. But let's assume the data for a moment is correct at 19,800, almost 20,000 cases. Yes, there's been a massive amount of cases being found, but let's see that in context. If we look at South Africa's new cases up to yesterday, it's almost 20,000. The United Kingdom at 51,000. The US, interestingly, the CDC gives you a 7-day rolling average, not a specific number. So, but for inference, we can look at what we have. And in terms of vaccinations, South Africa on 2 doses or complete vaccinations, as we call it, because we're also using Johnson and Johnson single dose, we're just over 15 million. The UK at 46 million. United States at almost 200 million. Importantly, the United Kingdom's almost more than 50, if not 60, and I speak under correction, percent of a third dose by this point. I didn't get enough data from the US because it's not as easy to infer. Omicron cases, interestingly, and I'm not sure whether this is based on sequencing, but based on the UK Health Security or Health Security Agency, they've got 568 confirmed cases of Omicron. Now, if we take this for granted and on the inference that it's been sequenced, then the United Kingdom is actually head and shoulders past South Africa based on what we have factually available right now. Because if we look at the numbers, and I just want to go back for a split moment to what we presented 2 days ago. When I spoke 2 days ago, my data was based on what South Africa put out on the 1st and then eventually supplemented on the 3rd of December. Apologies for the date, but it's 1st and 3rd. But the total sample ringed in yellow was 312 on the sampling. And in the tiny writing right at the bottom of the slide, the number of positive cases were 228 found in South Africa. Now, we were told, and everyone was told, and all my clinical colleagues in South Africa had the same conversations right to this morning. Terrence, wait, give them a week. We'll have more data, which is what we're telling the world, right? In a week, we'll know more. Which my suspicion is, and if you look at the green graph, which was Delta, we were doing 3,000 sampling in July. We did 4,200 or 300 in August. I expected the sampling to explode given the context of the panic and the lack of certainty that the world has from what South Africa is telling them. But interestingly, and I only found this 3 hours ago because although it's dated yesterday, it's actually only published today, and I waited up to get the data. If you look at the yellow circle on the right-hand side, the total number of samples are 358, done conclusively for Omicron in South Africa. So given what we have on this data, the United Kingdom is who we should be talking to for data, right? Because their numbers are a larger pool. If we look a little closer, this is what it means. We're only still sequencing November samples. I cannot understand. We're almost a third through December. We're telling the world the numbers are exploding from the 1st of December, month on month. And as we saw, if we go a few slides back, we're saying we 50% change in daily data. I want to know real data so I can correlate it with this. But I don't have that. I have these samples of older sequencing being done. But here's what's interesting. For the last 9 days in South Africa, we only have 46 new sequencing reported across 7 sequencing labs in South Africa. I'm missing something, or something just doesn't make sense in my head. But even if you look at the red graph, on their own reporting as of today that became public, The prevalence is 70%, which means it's 4% down from where it was last week. But again, I say this with the caveat and the concern that the samples still remain way too small to make any inferences. But let's keep this at the back of our mind whilst we look at some of the hospital data, which is more important based on what we spoke about of immune escape and vaccine escape and those kind of things. On the 1st of December, when I gave some of those statistics out, we were looking at about approximately 2,000 people admitted. The top green bar on the left hand side is what I'm talking to. If we then go slightly down to that, the dark blue is 235 people in intensive care facilities. Now, let me contextualize that for you. This is across 629 hospitals in the country. That sounds like almost 1/3 of a patient per facility on average, which is negligible. This doesn't correlate with the large number of concern that we had 2 days ago, last week, or even from the time we're talking about Omicron's taking over and transmissibility. Let's follow this and look to the right-hand side of the graph. What's important for me is the number of patients needing oxygen a week ago were 375. The current patients ventilated then were 112, which is not bad, but given the context, that's almost 1/6 of a patient across the country needing ventilation. We don't know the ages, we don't know the clinical context or any more information, or if the sequencing correlates. Then we look at the 9th of December, and I'm sorry this is so small, but all in, we're looking at 4,800 patients admitted. Let's look at the reality. We got 19,000, almost 20,000 new cases in 24 hours. This is not disjointed from that. It sort of correlates. What is interesting from this data is ICU admissions, and I apologize that they mysteriously just switched their colors around, but the green number now on the top graph is ICU, which is about 400 patients, which is not too far off from where we were of 253. So we've almost doubled the number of people in ICU, but I'll do the trend analysis just now. But what's very important for me is the ICU numbers are 148 from 112 of patients being ventilated. Yes, there's more people needing oxygen support. No doubt, given the numbers have increased statistically, there is a growth in that, which is fine. 8th of December, what I analyzed yesterday, which a lot of my data will link to, was 4,250 odd patients. So there's been a slight increase overnight, but we've also got to understand that I haven't been able to split the data between those who are funded on a private medical aid, who would benefit and have the funding to go into a facility, versus what's happening in the state. But interesting, if we look at the little green bar at the bottom, the number of people ventilated over 24 hours hasn't changed. Nor has the demand for oxygen has gone up 40 patients, negligible when there's 19,000 new positive cases. But ventilations haven't changed. Ventilations, to me, is what I'd use to at least draw an inference of seriousness of significant disease. Sorry. If we then look at 18 July, let's look at this in context of where Delta was. In Delta, there were more than 13,000 admissions. There were 2,400 people in ICU. Let's look back at this for the moment. ICU now is in the region of 300. We were then there at 2,400. Ventilated then were 1,400. Oxygen demand of 5,000. We have oxygen now at 10%. Ventilations at a fraction of that. I'm going to skip over the numbers because I've drawn this into a picture. This is just to give you a broad picture. Green was Delta in July. Yellow was the 1st of December. Blue was the 8th of December. Is there a slight uptick on admissions? Of course there is, because the number of patients have just grown. Do we know it's Omicron or not? No, we don't have enough of that with the 46 new confirmed sequencing data. Let's look at the ICU trend. The ICU was off the charts in the first bar, which was July during Delta. 1st December in the middle, and it's slightly trending up, but not reaching that peak of this accelerated seriousness that we have. In terms of interventions, which I think is the focus of what we should be looking, the yellow bar on the left-hand side is the number of patients needing oxygen in Delta, more than 5,000. Ventilations in Delta at about just over 1,400. Now let's look at that and let's ignore the 1st of December for a moment. 8th of December, 600, just over 600 people needing oxygen. And in terms of ventilations, you're under 200. This is a very, very, very different picture. And we're not early, we're 2 to 3 weeks down.
This is a very encouraging picture. Absolutely. I mean, yes, it is anecdotal data. This is not a study and a research, but still this data actually is showing great trends. I hope
Indeed.
that the death rate is also reducing drastically for us to be able to say that Omicron, regardless of all these immune escape studies, Omicron at a clinical level is not more damaging. I wish to reach that point where we could say that statement, or we could say, no, this is actually more damaging or equally damaging. We didn't have enough data. But I pray that we are able to say, not more damaging, actually better, and let's move forward. Do you have
Indeed.
any? So from here, this seems like it is moving to become more human friendly. Any what is your comment on this data that you just presented?
Mubin, I'm just looking for death rates. I haven't seen a number that can help us. Apologies, I was just trying to look for that right now. I don't have a direct number to talk to it, but the numbers are statistically low based on what is known at this
So
point.
based on the numbers for the ICU and oxygenation and hospitalization, how do you feel?
Here's the trend I'm seeing, Mubin. This I think to me is my own inference, and it may be a some people may think it's too much of a microscopic view. But if we're talking serious disease of patients that we have in July, of admitted patients, this is my caveat, of admitted patients, more than 10% of the patients admitted were needing to be ventilated. So 1 in 10 needed to be on ventilator support, which means Delta was brutal. On the 1st of December, 5.6% needed to be ventilated. Yesterday, 3.4% of admitted patients, not of the entire population. And today, 3.08%. We're 300% at least better than where we were in Delta if we compare the two waves. Delta, we're talking this was middle of July. I took it about 18th July, so central, which is about 3 weeks after Delta started. We're now almost 3 weeks thereabout of where Omicron is. And the trend of seriousness to me is very comforting to say the least.
So this is great news. If I can think about it, and you can say I'm thinking incorrectly. If I think about it, what I am seeing is number of cases are rising. Good. Good in a way I'm going to explain. Out of them, the number of cases going to hospitals are not a similar percentage as with Delta. Now, those who are ending up in the hospital, which is a smaller number, anyways, out of the all who have the infection, then within the hospital, there is 300% improvement as well towards ICU and oxygenation and hospital, other serious situations, ventilation. That that is a great trend.
Absolutely.
Am I
The,
correct in this inference?
Sure. Naveen, and this is not my numbers, right? This is data I've extracted from the data sets from the National Institute of Communicable Diseases. This is the public data that we're telling South Africa and we're telling the world. So all I'm doing is taking the numbers hidden in charts and large volume statistics, extracting these numbers and putting it here. So I mean, I'm literally taking these numbers that come out of this kind of statistics and then putting them next to each other to say, how does this picture look? And in terms of interventions, the left hand side being oxygen demand, and the right hand set of bar graphs, if I could call it, being ventilations, the trend is markedly more positive, meaning better than what we had in the middle of Delta. Again, the caveat is I'm trying to compare a sampling of the middle of July, but I tried to look for a fairly balanced sample, sort of mid sequence, to show us how bad it was to where we are now.
Got it. So this is a very common question as well, and I'm going to put that in front of us. How does all of this data plot with seasonal trends? And there are some more comments in the same line. Are we seeing the same data from N hemisphere, northern hemisphere countries that are entering winter? So is it something to do with the season? Have you had a chance to think
Yes.
about that and see that?
I think the not the number of interventions, and I don't know. I'm just gonna okay. I'm gonna remove the slides if you don't mind. I think what's important for me, Babine, is the season is important because in South Africa last year we had a similar uptick during the second wave of people getting closer to the summer holidays. Schools are closing, universities are closing, courts are closing, so the legal system largely shuts down and people go on holidays. Families are bonding, year-end parties, festivities like the rest of the world. But it's warm. People on the beaches, you're socializing. We're having braais, what others would call barbecues. So a lot of positive time. Last year, and this is my inference, I may be wrong, but looking at the trend of public health, last year people were frustrated by the time they got to the holidays because of what it did to their lives in the middle of COVID. This year, we as the medical fraternity have used phrases of immune escape, immunity passport, and that's created a massive misnomer in people's understanding that you're immune doesn't mean you're going to get, or it means to some people you won't get COVID. That's not true. I've been at large intra Africa conferences in the continent in which heads of businesses, CEOs, and even heads of states have said behind closed doors, you don't need a mask. I've been vaccinated. That is the level of misunderstanding, not with everyone, but to a large part of the population, not just in South Africa, but across the world, which in my view means last year people were frustrated. This year, people are saying, I've taken my vaccines, I'm safe, I don't need to worry, and I still need to now go socialize, spend time with friends, family, year end parties, and other related social activities, which may infer that's the social activities and the season being warmer in the Southern Hemisphere, particularly in South Africa, may be contributing to the uptick in numbers because I don't have enough confidence on the tiny sampling of the sequencing being done to make any inferences that it's Omicron driven, despite the questions of the mutation may create increased transmissibility.
Got it. Thank you very much. So I'm gonna. I know that we are 46 minutes into it, to 36 minutes. I'm gonna take a couple of questions so that we can see if there is anything at the top of people's mind. So Ray Kinney says, let's see, what might pharma do next, given Omicron taking over? So a similar question to this: do doctors use ivermectins or vitamin D's or other such early protocols?
In South Africa, ivermectin is not registered for any clinical use in humans at this point. It had been used at some point for limited use and other conditions not related to COVID. There's a strong belief amongst the non clinical world and amongst some clinicians, including veterinarians, that ivermectin may work. And there is some data that's being shared internationally and by some of my peers saying it most likely could work. I don't know enough of ivermectin being tested in South Africa in a clinical setting to draw any inferences. I'm not saying, and I know there were a lot of comments in our last discussion, what about ivermectin? You're ignoring ivermectin. I'm not ignoring it. It is possible. There is some inferential data from some parties that it may work. I don't know enough of ivermectin to comment because the primary registration in South Africa originally was veterinary use. Yes, it was used in human beings for particular uses and particular purposes. I don't know enough to make a
Got it.
professional opinion.
Got it. Fair enough. Fair enough. So then we have Frisco Coupon says, during Delta, how many patients ended up with concerning long COVID who didn't require ICU ventilator during infection? Is ICU and ventilator the gold standard of measurement for things?
Sure. I think maybe you can also chip in here, but my limited view, and I say this with respect to the cool beans, is we don't know how many people have long COVID symptoms as yet. I don't think there's been a particular focus of studies looking at long COVID. Has it been there? It's most likely. I know a lot of patients, but this is anecdotal. Friends, family, and patients that I've worked with and treated and participated in discussions with that there are long-term symptoms. So no doubt they most likely would be Delta symptoms. In terms of the correlation of ICU, what I'm trying to show is the massive concern of seriousness and significant disease and the difficulties we had in South Africa in managing Delta when it overwhelmed the healthcare system to a large extent. That's the lens I'm looking at it. It's not the gold standard measure. It's not a measure at all. It's my correlation in saying, how bad is it on the ground? Are we being overpowered? And are people getting really, really sick?
Got it. And just to add to this, Frisco Coupon, you've been here for a long time. The long COVID has been something that is not focused on that well. And so your point is correct that maybe the Omicron, even when it is not bringing people to ICUs and ventilators, it may still be causing or resulting in long haul, and we don't know about that yet. And if that happens, that is a problem as well. So that your point is taken. Unfortunately, I don't have good comparative data. Um, okay, this is a very good question. John Riaz says, and all questions are good questions. I just say it with every question. John Riaz says, Professor, what is the general attitude of the overall populace of South Africa? Happy, worried, confident, something else?
I say this as nuanced as I can. I can't speak for the general opinion because we haven't had a sampling nor public interviews around it. What I can speak of is my experience with friends, family, patients, and colleagues that I've met in various professions over the last week. There isn't a panic, there isn't concern because people are not seeing the numbers exploding or are not seeing the seriousness of the numbers on the ground. I spoke to a cardiologist who I spoke to last week who also said right up to last night, the numbers are not coming in the doors of the hospitals at the level of seriousness as we expected. And as we said 2 or 3 days ago, a large number of patients are being consulted for symptomatic or mildly symptomatic COVID and actually being sent home with symptomatic care and treatment.
Got it. There is a comment here, and this kind of comment has been sent to me multiple times. Mike Pump says, I heard from Dr. Ryan Cole that the vax is exacerbating cancer. It's a different topic compared to what we're talking about. So, Ryan, sorry, Mike, I'm going to leave this for the time being. We can talk about it in a separate chit chat. So, let's see. Let's take one more question and then we'll have. I loved your statement a couple of days ago. I would love to have a statement from you once more. So, Fran Crook says, is it possible any virus can become long haul, maybe creating, for example, chronic fatigue syndrome?
I would think so. And again, I'm going to speculate on that. I've seen patients with Epstein-Barr virus. I've seen patients with HIV. And yes, if it has a massive impact on your immune system in your body, which persists long term, it's very, very possible. Is it only COVID? I don't think so. Is it all viruses? I don't know.
Got it. So, Louis Grant is a medical student, just got out of the exam and stumbled into Mubeen Live again. Good to see you, Dr. Bean and Professor Kumar. So, with this, thank you very much, Professor Kamal, to be with us today. Thank you very much, Cool Beans, to be with us today in this exceptional morning talks. One more last statement to you for this talk. I would love to hear how you would like to look at the world at this time.
Sure. And without making a grand statement, some of your cool beans, some people loved it, some didn't. So let's be a little bit more neutral at this point. One of my favorite mentors, Swami Vivekananda, once said, they alone live who live for others. The rest are more dead than alive. My understanding of that is let's care for each other and appreciate that we are because of who we contribute to the community and society and be equally responsible for each other's lives and well-being in this uncertain times, not just around COVID, but due to the panic, the depression, the frustration, and the mental strain that it puts on everyone, every family, both in South Africa, the US, and literally across the world. So please stay well and stay safe and do the best you can.
Thank you very much. So, Cool Beans, thank you very much for joining today. Professor Kamal, thank you very much for joining today as well. Thank you for the insights, for the data crunching, for bringing us up to speed. I think I'm going to keep bothering you for a couple of more times till we become more clear about the data in there. So hopefully we'll request your time again, and hopefully you'll have time. So thank you very much for today, and have a good night.
An honor and pleasure to thank you for having me, Dr. Mubeen, as well as a great day to the Cool Beans.
Very good. Thank you.